afternoon, ladies and gentlemen, and welcome to the 2021 Long Island Business News Achievements and Healthcare Awards celebration. I'm Ali Jabbour, Associate Publisher at Long Island Business News. Thank you for tuning in to our online-based platform, which allows us to celebrate excellence in our community in a safe and responsible format. And while the honorees across all Long Island Business News programs are special, the people and organizations you'll meet today are truly exceptional. Dedication. It's a key ingredient to success, isn't it? Dedication has many faces. It's late nights at work striving to meet a deadline. It's what fuels our passion and our commitment to excellence in what we do. It sometimes means sacrifice and doing something difficult for the greater good. No one knows the meaning of dedication more than our healthcare community. To say our healthcare workers went through a battle is an understatement. In 2020, our species was at war, and it was our healthcare community on the front lines. For them, dedication in 2020 meant sleepless nights, even weeks, maybe months. It meant sacrificing for hope and then offering hope to others, even when hope seemed irrational. It meant sacrificing their own health and wellness, physically, mentally, for the sake of so many. Now, this is something our society discusses often, but as we hit the anniversary of a defining moment in human life, the dedication that our healthcare community has shown in the last year is truly what has saved us. And as we look forward to a brighter future full of vaccinations, plummeting infection rates, and opening economies, we must never forget at all how long and how we got here. My colleagues at Long Island Business News and I are honored to recognize just a few of these healthcare heroes, and we're thrilled to have you join us to celebrate their stories. We invite all our guests to share your own words and thanks to the honorees throughout the program. To do that, simply type your message into the chat box at the right-hand side of your screen. We also have to give a huge thank you to today's event sponsors, whose tremendous support made this event possible. Our major sponsor, Mazars. Our award sponsor, National EAP. Our contributing sponsors, Stony Brook Medicine, Ideal Health, Damianos Realty Group, and Long Island Community Hospital. Our virtual celebration sponsor, Northwell Health, and our nonprofit sponsors, All Things Home Care, Mount Sinai South Nassau, Family Service League, CN Guidance and Counseling Services, and Gerwin Jewish Nursing and Rehabilitation Center. Thank you for making today's program possible. To kick off today's program, please welcome Joe Dowd, Editor and Associate Publisher at Long Island Business News.
Thank you, Ali, and thank you everyone for joining us today. As a newsman, covering the healthcare sector was an eye-opening and often difficult experience this past year. It has been an honor to help share vital information with our community during this time, and it is an honor today to celebrate those who make a difference. As Ali mentioned, thank yous are certainly in order in today's program. In addition to the thank yous that you'll be sharing live in the chat box, we'll be featuring some thank yous from our other members of our community as well. We even have a special guest who will be joining us to congratulate our honorees later in the program, so be sure to stay tuned. The people and companies you'll meet in today's program were nominated by their peers, patients, and Long Island business community leaders. They were selected by an undisclosed panel. There's many honorees to meet, and all of them are equally special. So today we'll introduce them in alphabetical order by category, starting with our allied health heroes, honoring non-physician professionals who displayed exemplary performance in 2020. Let's see who they are.
Outstanding employee, role model, and a great human being. are just some of the phrases peers use to describe respiratory therapist and clinical educator Shada Alou. Coupling her compassion and expertise as a clinician to support and advocate for her patients, Shada rounds out her service to the community by serving as a natural educator. She is often relied upon by physicians to recommend the best practices when handling precarious respiratory situations in patients. After 40 years as a respiratory therapist and 20 years at Mount Sinai, South Nassau, Shada has time and again proven a vital member of the Mount Sinai South Nassau team.
Being a respiratory therapist, I have been doing this for 40 years and I've seen epidemics, but I have never in my life seen a pandemic like that. People from different departments came to us and said, what is it that we can do for you guys to help you? They were ready to learn, they were ready to help, and they were there with us all the time. We alone cannot do this. This was all teamwork. And I continue to hope that we can continue working like this because it's a blessed thing to come to your second family and work as a team.
Congratulations, Shada Alou. After earning his doctoral degree, Dr. Eric Bayer started his career as a physical therapist at PT2, then transitioned to Ready Care Physical Therapy, where he now serves as clinic director of the Farmingdale location. Despite the challenges of COVID-19, Dr. Bayer and Ready Care remained open throughout the pandemic and even offered home visits and telehealth appointments. Dr. Bayer is also a certified work steps provider and has a certification in applied functional science through the Gray Institute. His friendly approach and commitment to his patients fosters an encouraging environment that supports proper healing.
One of the most important things is the communication that you develop with patients. So it's very important to determine what the patient's needs are and what their goals are. They can kind of gauge when a clinician, truly cares about their progress and goes along the same lines of staying in communication with them and listening to the patient, because the patient is really telling you their story. Everyone has a story. And if you listen to the patient, they're kind of giving you clues as to what treatments might work or might not work.
Congratulations, Dr. Eric Bayer.
Congratulations to our allied health heroes. Next, let's meet our honoree in the category of alternative medicine, recognizing a company for exceptional care.
When it comes to treating patients through holistic, positive methods, Patchogue-based Pure Health and Wellness is in a league of its own. Praised by patients for its empathetic and caring approach to treatment, the facility offers aesthetic treatments, holistic pain management, IV vitamin therapy and boosters, medical massages, regenerative medicine, nutrition and weight loss practices, and more. The services provided by the practice contribute to the health and happiness of the community it serves.
So many of our patients felt that their life had changed, and they were looking forward to being in an environment that supported them. Probably one of the biggest aspects is both psychologically and medically helping the patient, both through time spent with the patient and medical modalities. In any aspect of life, if you can pivot out of the norm and see an ability to find strength and courage, you're going to succeed.
Congratulations, Pure Health and Wellness.
I want to thank the staff of National EP, the clinicians,
all the doctors.
I wanted to thank my staff.
Thank you, Dana.
You have been a driving force for support.
I'm so proud of all the hard work and dedication.
Thank my family, my organization.
My family's my backbone.
My daughter and son-in-law for giving me a grandchild during COVID.
The amount of uplifting and coordination between segments of the medical community has been just remarkable.
Congratulations, Pure Health and Wellness, and thank you. We move on to the honorees in community outreach and education, recognizing those reaching outside of their normal sphere of business to focus on a healthcare issue or solve a community problem.
founder of both LI Obesity and Huntington Hospital's bariatric program, where he serves as Director of Bariatric Surgery. Dr. David Buchan is the only MBS AQIP verified surgeon at Huntington Hospital. He's performed over 5,000 bariatric surgeries, and his program has earned the designation of Bariatric Surgery Center of Excellence. Throughout the pandemic, Dr. David Buchan has focused on learning more about how COVID-19 impacts his patients, which has created unparalleled confidence from them during these uncertain times.
We started the Healthy Huntington Initiative in April of 2020 to bring awareness of the effects of COVID on obese individuals. And the fact that during this quarantine period, a lot of people were gaining weight. We really wanted to bring awareness and what they could do to actually lose weight during this time period. It actually was picked up by Real Time with Bill Maher. And he basically said that we really should, as a society, get healthier to battle this disease. That was a really cool moment.
Congratulations, Dr. David Buchan.
George Calcanes serves as practice ambassador at New York Cancer and Blood Specialists, and since 1998 as chief clinical officer. As a registered nurse, he's cared for patients in various units, from emergency care to hospice, and was influential in the accreditation process for CAP, CLEP, ACHC, and QOPI. To this day, he continues to engage the NYCBS community and work with his colleagues to help leverage their respective strengths. In the face of COVID-19, George has worked hard testing patients on-site at NYCBS locations and has been active in kickstarting programs dedicated to keeping patients safe.
Our initiative at New York Cancer and Blood Specialists is keeping our care close to home so that the folks don't have to travel a distance to get the care they need for whatever their diagnosis is. We did not stop care and treatment of the patient during COVID, but we did safeguard them with essential PPE and the amount of folks that are allowed in the facility at a time. The staff really bought in on this, and we pretty much were able to continue practicing through the whole last 10 months of this.
Congratulations, George Calcanes.
As Executive Vice President and Chief Learning Officer for Northwell Health, Dr. Kathleen Gallo has supported the development of the Center for Learning and Innovation, Northwell Health's corporate university, including the Patient Safety Institute. She also serves as founding dean of the Hofstra Northwell School of Nursing and Physician Assistant Studies. Throughout the pandemic, Dr. Gallo has worked to create a campus-wide COVID testing and surveillance program to meet the community needs of the Hofstra campus. She also served on the University Task Force for Reopening, fostering an inclusive environment and ensuring all concerns were addressed and needs were met.
The School of Nursing has assumed strategic leadership over the student health services at Hofstra University. I was honored to be asked to serve on the University Task Force for the reopening of the university, which started last September. So a lot of work has been done in an effort to educate and to keep both the university and community healthy and safe.
Congratulations, Dr. Kathleen Gallo.
Founder and president of healthcare-focused marketing firm Prescriptive Communications, Teresa Jacobellis is also host of the Healthcare Confidential podcast. Launched during the pandemic, the popular podcast sheds light on the many nuances of the American healthcare system, ranging from business to finance, research, clinical, and regulatory issues. With over 40 episodes, her expert guests cover topics such as the epidemiology of COVID-19 and the mental health toll of the pandemic.
I started the Healthcare Confidential podcast during the COVID-19 lockdown as a way of sharing information and education with people both within healthcare and outside of healthcare. And it was a way of battling what has become the infodemic during this pandemic, which is the great deal of misinformation that's being spread online and through other forums. The podcast gave me a chance to bring healthcare experts together to share their perspectives, to share their knowledge and expertise, and to give really sound advice to listeners.
Congratulations, Teresa Jacobellis.
After serving as a registered nurse supervisor at Stony Brook University Hospital, Nicole Laborde set out to find Ideal Home Care Services, a licensed home health care agency that has provided care to over 1,000 seniors and others across Suffolk and Nassau counties. Recognizing a need for training caretakers, she later launched the Ideal School of Allied Healthcare, a licensed program offering 12 curricula, including home health aide, nursing assistant, medical assistant, and more. Nicole is also the founder and CEO of Ideal Home Care Staffing and Ideal Home Care Franchise, and is committed to empowering her fellow healthcare community members.
First off, we are licensed by the state, Ideal Home Care and Ideal School of Allied Health. Our priority is to deliver quality home care services to our seniors, both in Suffolk and Nassau County, by training and hiring the right people. Especially in this environment, it is vital more than ever to have quality staff providing quality services to the community at large.
Congratulations, Nicole Laborde.
Recently appointed as the first Health and Wellness Ambassador for Discover Long Island, Dr. Michelle Reed is a board-certified family medicine physician, public speaker, and best-selling author. Her debut book, Mentally Fit, Physically Strong, The Fit Doc's Guide to Real Life, Real Fitness, Real Health, was released in May 2017 and quickly became a bestseller. She also serves as an adjunct assistant professor of family medicine at NYU Long Island School of Medicine and as the school district physician for the Malvern, Hempstead, and Roosevelt school districts. She remains committed to serving her community any way she can, particularly throughout the pandemic.
As medical director and owner of MS Family and owner of Fit Doc Total Wellness, the two of them have been serving the communities for over 19 years. And one of the things that we like to do is always to educate people so that way they can be their own advocate. When COVID happened, the ability to us to be able to speak to our patients using technology made people feel very comfortable, and they trusted MS Family Medicine because we were there for them when they weren't able to physically come in and see us in the office. And therefore, they were also able to continue with taking their medicine and also know that we really, truly do care for them.
Congratulations, Dr. Michelle Reed.
Born and raised in Beijing, China, Chandler Zhang moved to New York in 2012 to pursue his master's degree and started his career at Northwell Health in 2017 as the Institutional Review Board Coordinator within the Human Research Protection Program at the Feinstein Institute for Medical Research. Zhang is also the chair of the Berg Language Advisory Board and also serves as IRB analyst for the Department of Medicine and the Department of Oncology. On a volunteer basis, he also serves as the administrative person in the COVID vaccination point of distribution at Chinatown in Manhattan.
So COVID-19 really impacting everyone, especially for the healthcare workers, even though we are not working on the front line to see patients at there, but we as research administrative people over here, we all providing a lot of support. We make sure we have a good communication with our study team, with our study coordinators. Our job is to make sure we protect subjects' welfare. We need to make sure they are safe, right, in those kind of trials. We have so many trials like remdesivir, hydrochloroquine, those kind of trials happening at Northwell. So we see those kind of studies really carefully, and we want to make sure everyone joining the study team is being protected.
Congratulations, Chandler Zhang.
Launched in 1972, Central Nassau Guidance and Counseling Services has worked to inspire and catalyze recovery for people living with mental health and substance use conditions through clinical treatment, counseling, housing, and more. For over 47 years, the nonprofit agency has served economically disadvantaged, uninsured, underinsured, and disabled or otherwise marginalized members of the Long Island community. Especially throughout the pandemic, CN Guidance has been hyper-focused on supporting mental health within the community.
Mental Health First Aid is a curriculum designed for everyday people to recognize others who may be experiencing symptoms of a mental health crisis and know how to safely intervene.
With the ability of connecting with the communities and the different people that we serve here at CN Guidance and Counseling Services, we're increasing mental health awareness, and it's filling in those fears of isolation and loneliness of being home during this pandemic.
Our goal is to help every community member to reduce the stigma, to instill hope. COVID-19 has impacted us all personally, professionally, but we're not alone. We're all in this together.
Congratulations, CN Guidance.
Mary McCormick, Carol Zarconi, and Kendra Hepper of Malloy College are nurse practitioners who work in both clinical and academic settings, sharing a passion for improving cardiac arrest survival rates. Together, the women are dedicated to providing community awareness, educating and hands-on CPR training to over 300 students, faculty, and staff at Malloy College. When COVID-19 hit, the team was able to pivot to virtual training and continue educating their community.
Along with Kendra and Mary, we are looking to improve survival rates for people that have out-of-hospital cardiac arrest by teaching hands-only CPR to the community.
We also have collaborated with the Public Safety Department and identified areas that additional AEDs would be useful and placed an additional 9 AEDs on the college campus. And the AED is an automated external defibrillator.
I have been very blessed and honored to be part of this initiative so that we can improve the outcomes in our community, and working within schools and community centers and branching out to other college settings. That's really our goal. And every time we do this, it just brings me joy to know that we are improving the outcomes in our society.
Congratulations, Mary McCormick, Carol Zarconi, and Kendra Hepper.
I would like to thank the training team at CN Guidance and Counseling Services.
Thank you. Food service people, the people supplying the PPE.
They've been wonderful to our company and to the community.
Thank you always.
The most important people to thank are my patients.
Everybody for being cooperative, for being patient.
Grateful to all of our employees.
The IT folks and the unit clerks.
This man, I'm very grateful and thankful.
I'd like to thank my husband,
the midwives,
to everyone that showed up.
True healthcare heroes, true courageous hearts every day.
Congratulations to all our community outreach and education honorees. And while all our healthcare workers are heroes, let's recognize our COVID-19 heroes, which includes professionals and organizations for their spectacular response to the pandemic-related efforts.
Director of Nursing at ACLD, Faith Mazzone coordinates with the nutritionists to ensure consistent implementation of dietary modifications and orders, and develops policies and best practices across the department. She also runs a residential program that supports 400 adults with autism, intellectual and other developmental disabilities, coordinating medical care with internal and external providers. In 2020, Faith's dedication was credited with helping ACLD establish essential protocols and preparations before COVID-19 hit U.S. soil. And despite managing her own battle with cancer, Faith has continued to serve as an essential member of the ACLD team.
In our lives, adversity is inevitable. The goal is to be resilient and move forward. Ensuring the health and safety of the people supported by ACLD has been the motivation behind my continuing to work while undergoing cancer treatment.
The best part of working with Faith, honestly, is that she's an endless well of knowledge. You can bring to her any medical related question, and she almost always has the answer and knows exactly what needs to be done.
One of the things that makes her a hero is her selfless nature. Despite all of the things that Faith may personally be going through, none of those things ever take into account when it comes to the people we support.
Faith embodies for the organization what it really means to advocate for the people that we support. I've been in the field for 27 years and I've dealt with numerous nurses and numerous nursing directors. And I have to say, Faith is probably the best one in my career that I've ever had the privilege of working with. That's what makes her my hero.
Congratulations, Faith Mazzone.
As Chief of the Division of Pediatric Infectious Diseases at Stony Brook Children's Hospital and Associate Dean for Research at Stony Brook University's Renaissance School of Medicine, Dr. Sharon Nachman has been at the forefront of the COVID-19 pandemic since the beginning, working long shifts to support both her patients and colleagues. In fact, she was chosen as one of the 6 leading health professionals on New York's Independent Clinical Advisory Task Force to review every COVID-19 vaccine authorized by the federal government, as well as advise New York State on the vaccine's safety and effectiveness in fighting the virus. It is because of people like her that we find hope in returning to normal life.
What I've done is a reflection of the institution's success. No one person could be successful without a huge team behind them, talking to them, encouraging them, and basically working with them every step along the way. Taking care of patients was successful. Developing clinical trials so we could give our patients the newest and best medicines was also successful. And then being able to be site for adult vaccines for COVID and hopefully pediatric vaccines for COVID is our most recent success, and it's due to everybody working together.
Congratulations, Dr. Sharon Nachman.
Stony Brook Southampton Hospital was the first hospital in Suffolk County to experience a positive COVID-19 case. Despite having no prior experience treating the coronavirus, the hospital was able to successfully care for the patient before discharging him to successfully continue his recovery. Armed with experience, medicines, protocols, and PPE nearly a year later, the hospital continues to fight in the war against COVID-19. In fact, they're participating in the coordinated rollout of vaccination pods throughout the East End.
I personally have never been so proud to be working in healthcare. This is a field that has so many challenges. We go around the clock 365 days a year in healthcare. And our staff members do whatever it takes to take care of patients. And it is really, really a marvel from my perspective. And I'm so thrilled that my institution is being honored for the courage, the determination, and frankly, the resilience they've shown over the last year.
Congratulations, Stony Brook Southampton Hospital.
A skilled nurse practitioner, Diana Youngs, earned her degree from Yale University School of Nursing. She's worked at New York Cancer and Blood Specialists since 2004, providing compassionate care to each patient. In the past, Diana has supervised and overseen several nurse practitioners and clinical staff. Her exemplary clinical experience has been noted in several publications and research investigations. And she is a vital asset to NYCBS.
One of the times that I felt like I had accomplished a win in the battle against COVID-19 was when we as an organization were able to bring COVID testing in-house, that we could do COVID testing for our staff members and also for our patients. I'm very proud of the efforts that we've been able to make, test people efficiently and effectively to help bring down the curve, bring down the numbers, and to give us the ability to continue to provide good care to our patients in a safe way.
Congratulations, Diana Youngs.
Established in 1926, Family Service League is a leading Long Island nonprofit organization that provides support to both children and adults in need through crisis interventions, such as mental health counseling, addiction prevention and treatment, housing, trauma counseling, and more. In the face of COVID-19, the organization has offered free counseling to frontline workers and provided care to those who are isolated in long-term care facilities, as well as their loved ones who are unable to visit. The organization's commitment to providing ongoing care and support throughout the pandemic has sought to alleviate some of the pain and fear our community has faced.
Our message for other healthcare professionals is simply to continue to heed the warnings of the CDC, Department of Health, And I really found that for Family Service League staff really helped to guide us through this pandemic. You know, our primary goal is to keep everyone safe, our staff and our clients, and we hit the mark with everything we did. We were really very rigorous with following all the protocols, and that helped our staff. They, had tremendous gratitude that the leadership of the organization showed that we really cared about them and our clients.
Congratulations, Family Service League.
The staff of Gerwin Jewish Nursing and Rehabilitation Center has worked tirelessly throughout the pandemic to care for residents and act as lifelines to them and their loved ones. These healthcare heroes have been devoted to serving as caregivers and friends to hundreds of medically complex older adults. They've also served as messengers and helping hands to families, particularly when visitation has been suspended, and swiftly crafted virtual ways to keep families together. President and CEO Stuart Almer has shared admiration for the staff's selfless determination to protect the community's most vulnerable population during these unprecedented times.
We are accustomed to, in healthcare, having to deal with many challenges and many crises. It's important for us during such a sustained crisis to stay focused and committed to provide solid leadership and support.
Congratulations, Gerwin Jewish Nursing and Rehabilitation Center.
Since 1952, Visiting Nurse Service and Hospice of Suffolk has provided high-quality care to patients facing health crises. The organization makes over 80,000 home visits annually, caring for patients in their own homes and assisted living facilities, and providing inpatient care at Hospice House. To continue home care and hospice services during the COVID-19 pandemic, VNSHS has made several accommodations, like training clinicians and patients on taking proper precautions, enhancing patient screenings and limiting visitors, offering remote bereavement services, and more. The staff is resilient and dedicated to helping each and every patient, including their loved ones, through this difficult time.
COVID-19 presented a challenge for everybody. We in our organization provide home care and hospice care in the community, making visits to people in their homes. We needed to continue to make these visits. People still needed our services. So we had to begin with our staff, making sure they were fully geared up with PPE, the masks, beyond what we would normally use. When it became available, we started testing. And then when the vaccine became available, we applied to become a provider. Again, not just for our staff that we wanted to protect, but for the community.
Congratulations, Visiting Nurse Service and Hospice of Suffolk.
I'd like to start off by thanking my family.
My husband, Marty, and my children, Aiden and Maeve.
My family, my husband, Chris, and my children, Nicholas, Shane, and Natalie.
My husband and my children have always been supporters.
My staff. Our All Things Home Care board.
My wife, Rajdeep Paulus, my 4 girls, amazing kids.
I would like to thank Long Island Business News for recognizing people tonight who they feel have gone above and beyond, keeping in mind that we are all grateful, but all we're doing is just doing our job. But thank you very much.
Congratulations, COVID-19 heroes. Thank you for your dedication. Next, let's meet our Dentist of the Year.
Dr. Barry Bass is the director of the Department of Oral and Maxillofacial Surgery, surgical director of the Implant Training Program, and co-chief of the TMJ Facial Pain Clinic at Northwell Health in Manhasset. He also teaches at Stony Brook School of Dental Medicine, just one of his many roles in volunteer work. The board-certified diplomate of the American Board of Oral and Maxillofacial Surgery often travels to rural U.S. areas through the Remote Area Medical Organization to treat patients who can't afford oral surgery. Outside of dentistry, Dr. Bass is the chair for the UJA Northwell Healthcare Division and on the UJA Summerfest Committee.
Fortunately, I ended up choosing a profession that became an extremely rewarding type of profession that I never dreamed of. Obviously, a dental office and an oral surgery office has a large volume of patients coming in as well as their escorts. And with the pandemic, we have to limit that volume of crossover patient to patient and us to patients, but at least we have a business and we're surviving and thriving.
Congratulations, Dr. Barry Bass.
Congratulations, Dr. Barry Bass. Now, let's take a quick break to hear from a very special person, someone that, if you're into medical comedy shows, you might know quite well.
Hello, healthcare heroes of Long Island. It's Johnny C Mcginley. I'm thrilled to be able to tell you a couple of things. One, you are spectacular. Two, you are loved. Three, you are respected. We are awed by you, what you've done for the last year, every shift, all day, all night, graveyard shift, has been the stuff of heroes. You are heroic. You have more spine in your pinky than most of us will exercise throughout the entire course of our lives. I don't know how you've persevered like this. You are an astonishing group. Doctors, nurses, support staff, the whole health-related group that has exercised more kindness and more expertise and more inclusion, and the way you've taken care of this flock on Long Island is heroic. I know you've been in it so deep and so long, and you've made so many sacrifices. You may not even be able to see just how amazing you truly are. So I'll tell you, you are stunning. It is miraculous what you folks have done for the last year or so and beyond. But it's really been on display over the course of this pandemic. You are appreciated, you are respected, and most importantly, you are loved. You are loved. Thank you for everything you've done.
Thank you to John C. Mcginley, also known as Perry Cox from Scrubs, for taking the time to thank our honorees. He turned this video around within an hour of LIBN contacting him with the request, so thank you, John, for the heartfelt message. Now, let's keep up with the energy with recognizing a leader in our healthcare industry who is being granted today with a leadership award.
As the president and chief executive officer of Long Island Community Hospital, one of the last remaining independent hospitals in the state, Richard Margulies had to step up when COVID-19 hit. His staff has praised his response and leadership during the onset of the pandemic, which included his action to develop a COVID-19 task force to oversee the hospital's emergency management plan, and swift procurement of additional PPE and staff. In just 3 short weeks, the CEO raised over $1 million to help support the staff and patients of the hospital. He also created emotional wellness programs for his staff of over 2,500 employees, showing them compassion and care.
We have a great team of professionals and support members here, an engaged board of directors, a very talented medical staff, and a professional, competent, and empathetic nursing staff. Of course, we face challenges every day due to the ever-changing healthcare dynamics. We overcome those obstacles on a daily basis. We're proud of what we've accomplished, and we look forward to the future and to continue to be here to serve our community.
Congratulations, Richard Margulies.
Congratulations, Richard Margulies. Now, we move on to the Mental Wellness Award honorees, highlighting individuals and organizations for exceptional service in addressing mental health in our community.
As Suffolk County's central resource for residents facing mental health challenges, the Association for Mental Health and Wellness was challenged with modifying and sharpening many of the services it offers. Many of those efforts included overcoming the limited ability to provide in-person services. The association successfully rolled out virtual programs for its nearly 7,000 clients, many of whom are veterans. It also created virtual bereavement support groups and offered mental health training for police officers. It also increased its work through its 3 food pantries by nearly 200% in 2020.
You know, from the fear of the infection to the fear of death for ourselves and for our loved ones, to people facing job loss and recession, and just the uncertainty of it has really created this perfect storm for people to feel really stressed and anxious and overwhelmed. Sometimes just setting small goals for yourself can be very helpful. I think it's also really important to be grateful, acknowledging that the feelings that we're all going through are to be expected, but that if you are feeling overwhelmed or if you are having thoughts of suicide, you don't need to sit with those emotions alone, that there is support out there for you.
Congratulations to the Association for Mental Health and Wellness.
For Dr. Janet Kahn-Scalero, Administrative Director of Behavioral Health Services at Mount Sinai South Nassau, mental wellness is a calling. Overseeing one of the most comprehensive inpatient and outpatient behavioral health programs in the state, Dr. Kahn-Scalero has helped the community, as well as staff, obtain vital emotional and behavioral support in 2020. Her guidance has also helped Mount Sinai South Nassau obtain recognition as one of the first healthcare providers in New York to open an outpatient healthcare center that integrates behavioral health and primary care services under one roof.
I think one thing people can do to improve their mental health is, number one, just give themselves some grace. You can have good days, you can have bad days. You can have days where you feel despairing. We all do. And then there are days where you feel a bit hopeful. And so to understand, number one, that that's normal and that's okay. And second, to listen critically to the news and the hype, to really take a step back and try the best you can, just to do the best you can. And that's enough.
Congratulations, Dr. Janet Kahn-Scalero.
National EAP Incorporated is a top-tier provider of employee assistance programs and corporate development services. When the coronavirus pandemic struck U.S. soil, National EAP launched a daily COVID support, education, and outreach program for their clients. Through this program, they delivered live webinars daily, which included support groups, educational series, and meditation sessions. They were also swift in creating a 10-week outreach program for Northwell Health and its employees, setting up employee assistance programs at 17 of their hospital locations.
The impact we saw right away at National EAP was, for members, was increased anxiety, sleeplessness, all the signs and symptoms of stress, but more severe as time went on. What we did at National EAP to counteract this, immediately we ramped up an education series, a daily education series for members, and then we opened it up to the community, addressing what the normal reaction to this abnormal situation was that people are experiencing. I recommend everybody have a therapist, somebody you can turn to that can really help you pay attention to your mental wellness.
Congratulations, National EAP Incorporated.
Throughout the pandemic, Stony Brook Medicine has implemented a series of mental health and wellness initiatives in order to support their frontline healthcare workers. They prioritize the well-being of their diverse team, which includes psychologists, nurses, social workers, physicians, patient advocates, and other healthcare providers. Exceptional efforts were noted in particular by Assistant Director of Nursing Psychiatric Acute, Jessica Marangio, Associate Director of Nursing Suzanne Marriott, and Director of Behavioral Health Services, Adam Gonzalez.
During the COVID pandemic, our employees have been working nonstop, day in and day out, and over time that does take a toll on mental health and wellness. A couple of things that I would suggest. One is making sure that you're reaching out to others, getting support from one another. That's one of the most important things we can do right now, is to really connect with other people. The other thing that I would recommend is practicing relaxation techniques like mindfulness meditations, which are really helpful to stay grounded in the present moment and be able to experience just a little bit of relaxation each day can be really helpful.
Congratulations, Stony Brook Medicine.
Congratulations to our Mental Wellness Award honorees. Now, let's invite back Ali Jabbour, who will introduce more of today's honorees.
Thanks, Joe. I hope everyone's being active in our program chat box. Don't forget to chime in with your thanks and congratulations. Next, we feature our Nurses of the Year, recognizing those whose performance in 2020 was highlighted as exceptional.
As an emergency room registered nurse, Michelle Burke fights to make sure every patient has the best chance for recovery. Despite the fears and stress she lived with while working during the pandemic, Michelle continues to lead the charge both within and outside of the ER. She raised over $16,000 for a fellow nurse and her family, donated over 495 masks to her unit, and led the ER through their Kids for Kids Meals on Wheels program. Today, Michelle is pivoting to become a professor, teaching the lessons that served her and her community so well.
2020 really demonstrated our selflessness on the front lines. Nurses have been recognized not only in New York State for their selfless bravery, but globally. Nurses worked 12, 13 hours, sometimes without taking care of themselves, risking their own lives. It's incredibly important, not only now, but forever, that we recognize nurses for their selfless bravery, day in and day out.
Congratulations, Michelle Burke.
Dr. Lucille Hughes is among the nation's forefront leaders in diabetes management and an expert in insulin pump therapy. As the Director of Diabetes Education and Service Line Administrator for Digestive Health and Endocrinology for Mount Sinai South Nassau, she is passionate about educating the next generation of healthcare professionals. Her leadership has helped the center become accredited by the American Association of Diabetes Educators. During the pandemic, Dr. Hughes was also proud to assist her colleagues on the front lines by administering COVID-19 tests and vaccines.
My message to other nurses and doctors in our community is that I salute you. I'm very proud and honored to work alongside you during this critical time in history. There's a bond that connects all of us to each other, and no matter what our role, we will always rise to the occasion, putting our patients first. This is the most challenging year probably we've all had to work in. However, I do believe that we can see the light at the end of the tunnel. We must stay strong and know that we are winning this battle, and we will win.
Congratulations, Dr. Lucille Hughes.
Despite the challenges the last year has posed, registered nurse Paige Lassen has not been deterred. With the U.S. healthcare system completely overwhelmed, Paige and her colleagues bravely floated between units, seamlessly adapting to new protocols while facing a major PPE shortage. Despite contracting the virus herself in March of 2020, Paige bounced back post-recovery in full force and was eager to donate plasma to help further research and care. Just another testament to the blood, sweat, and tears she put into the battle.
My message to other nurses in our community is to keep fighting. There isn't a life this virus hasn't impacted, but what it did show us is what we are capable of and the mountains we're able to move when we work together. A light was shined on our role as RNs during the pandemic, and without a doubt, our responsibilities have increased, which is now our new normal. But I'm proud to say we rose to the occasion, we stepped up, and we got it done like nurses always do and have been for generations. It's amazing and inspiring. I hope we continue to support one another, work together, and do our part to make the world a better place. To all the fellow frontliners, we have made history.
Congratulations, Paige Lassen.
When Mount Sinai South Nassau needed a leader for their rapid testing drive-through site, they knew they could trust Amber Vitale. A family nurse practitioner, Amber helped build and lead a community rapid testing site, testing over 17,000 patients and offering guidance, expertise, and more than 12-hour days since the first drive-through testing site opened in May of 2020. Now, as the newly designated Director of COVID-19 Community Services, Amber continues to spearhead South Nassau's response to supporting the community and managing the spread of COVID-19.
My message to all the nurses in the community, all my brothers and sisters, my fellow nurses, during this time, your hard work, your determination, your perseverance, and your selflessness carried us through this pandemic. You did things that none of us would have ever imagined that we'd ever have to go through. And I just want you all to know that what you did during this time was never unnoticed. And I am so glad and so blessed to work with amazing nurses in all areas of nursing. I've been so grateful to work alongside with.
Congratulations, Amber Vitale.
There are so many people to thank.
Jeffrey Friedman, our CEO, and our administration.
I would like to thank my training team,
all of our staff, all of our volunteers, the board of directors,
the patients that trusted us.
I would like to thank my family and the ACLT team.
To our entire staff of over 700 employees.
Our CEO of the hospital, Rich Murphy.
Thanks.
The professionalism, the purpose of these young folks, it's heartwarming, and we can't thank them enough.
Congratulations to our Nurses of the Year. Our next category is unique and recognizes a team of nurses for their unique circumstances in 2020, which resulted in quite a story.
For many, the world appeared to pause in 2020. But for millions of families, beautiful new lives were being born into a hectic world. Within Stony Brook University Hospital's Labor and Delivery Unit, 5 nurses stepped up to provide excellent care and a sympathetic ear to their patients, all while carrying unborn children themselves. They adapted their plans to care for Long Island's vulnerable pregnant population, maintaining constant communication and offering a unique camaraderie for the expectant mothers they worked with.
Being able to talk about our pregnancies with each other kind of took away some of the stress and anxiety about being at work and being smack dab in the middle of this pandemic and taking care of COVID patients.
Being pregnant during the pandemic really allowed me to have more empathy for my patients, because not only did I understand what it was like to be pregnant and know exactly what they were going through, but also how scary it was to be pregnant during a pandemic.
I was able to relate to them. I was able to ease some of their anxieties and worries of not only becoming a new mom for the first time, but not being able to have any family around or friends to help welcome this new life into the world. And myself, along with all my other colleagues who delivered their babies, had to go through the same thing. So it was really special.
It's my first time being a mom, so it was really nice to have other women at work going through the same thing in the same moment that nobody else has gone through. So we were able to kind of connect more on that level.
It was a privilege to be able to be there for these women during their childbirth and through such a vulnerable time. Looking back, I can tell my baby that she was with me every day at work during a pandemic, and we survived it, and everything's okay.
Congratulations to Stony Brook Labor and Delivery nurses Danielle Moore, Ariana Drescher, Erica Massa, Elena Lucretia, and Caitlin Falcone.
Congratulations to Stony Brook Labor and Delivery nurses Danielle Moore, Ariana Drescher, Erica Massa, and Elena Lucretia, and Caitlin Falcone. What an inspiring story. Next, let's meet our Physicians of the Year, recognizing medical doctors for performance that is considered exemplary by patients and peers.
Since the start of his career, Dr. Ross Chafkin has sought to address his patients' concerns with professionalism and sincerity. As a dental surgeon at All County Oral and maxillofacial surgery, he has committed to offering additional hours to those facing medical emergencies during COVID-19, including vital surgeries for those requiring immediate care for facial traumas. Dr. Chafkin has always believed in being an active New York community member, contributing to the Salvation Army, Laptops for Learning, Melville Chamber of Commerce, and New Hyde Park Chamber. He is slated to open his 4th office later this year.
Well, I would think that being in the dental profession,
We weren't extremely front line, but I think my win was keeping emergencies out of the emergency room during the height of the pandemic. We stayed open throughout, saw endless numbers of dental emergencies over the course of 3-4 months when nobody else was open. So that's where I feel myself and my staff have really helped out.
Congratulations, Dr. Ross Chafkin.
Dr. Ciro Ciccarelli dreamt of being a doctor his entire life. And it was a global dream, as after earning his Bachelor of Science from St. John's University, he ventured to Bologna, Italy to obtain his medical degree. Currently an attending physician at Mount Sinai South Nassau Communities Hospital, Dr. Ciccarelli logged hundreds of hours rounding the hospital's special units to prepare for COVID-19 patients, providing compassionate, expert care necessary to defeat the novel virus.
This was a huge team that all came together. They all stepped up. They all had families at home. They knew by them coming to work, they were putting their lives on the line, despite the family that they left their families to come to work. We all had fear in us. There was no one that was not fearless. I doubt there was, but we all came to work because we knew we had a job to do. We did that job, we continue to do that job, and we'll do it for as long as it takes.
Congratulations, Dr. Ciro Ciccarelli.
Since 2017, Dr. Carrie Frommer Firestein has served as an executive board member of Adjuvant Health, a premier managed services organization offering medical practice solutions and administrative consultative services. She also serves as CEO of Allied Physicians Group. Dr. Firestein is noted as a steady leader who can see the big picture and seamlessly times projects and work into organizational goals. A strong believer in the importance of physician leadership in the healthcare arena, Dr. Firestein was at the forefront of highlighting the importance of independent pediatricians to have access to vaccinations.
During COVID, we've seen that our patients and our communities need us more than ever, not only giving direct one-on-one patient care, but giving guidance, helping with epidemiologic questions about schools, about everything that's going on, because there are no pat answers, and our patients and our communities need us to give us the honest information that we have when we have it.
Congratulations, Dr. Carrie Frommer Firestein.
Dr. Louise Safran knows firsthand the pain caused by COVID-19. When the physician and assistant clinical professor of ICAHN School of Medicine at Mount Sinai South Nassau contracted the virus, he felt helpless. Dr. Safran felt the pain of so many families during the pandemic when his mother lost the battle to COVID-19. Knowing the perseverance needed to fight the virus, Dr. Safran led a team of cardiologists, anesthesiologists, physician's assistants, and nurse practitioners to help prevent patients from being infected. The co-chief of critical care and pulmonary specialist worked for 60 straight days, averaging 12 to 16 hours per day, to care for critically ill COVID patients.
During the early onset of the pandemic, a lot of physicians did not know what their role was going to be, and many of them came forward and helped us in the hospital and fulfilled roles that they normally weren't trained to do. My message to them would be to continue encouraging patients to get vaccinated. At this point, weighing the risks and the benefits of a vaccine versus getting sick with the virus, we should all lean towards getting the vaccine. Once a significant amount of patients in the population are vaccinated, then we could go back to life the way it was prior to this horrible pandemic.
Congratulations, Dr. Louise Safran.
As chief of the Vascular and Endovascular Surgery Division at Stony Brook University Hospital and director of the Stony Brook Vascular Center, Dr. Apostolos Tassiopoulos helped develop new procedures to help improve the outcome of COVID-19 patients. He identified a potential heart risk in patients and developed an aggressive protocol that was later implemented hospital-wide. The procedure developed by Dr. Tassiopoulos and his team has aided in preventing COVID-19 patients from developing blood clot formations after they've recovered from infection.
In the early stages of COVID-19, our team was called to see patients that were presenting very uncommon thrombotic complications as a result of their COVID-19 infection. We worked with our ICU colleagues and with our hematologists at Stony Brook to devise a protection plan that we applied to our patients, and that resulted in a significant decrease in patient mortality as compared to other institutions locally, but also nationally and internationally. We feel very proud that we had a contribution from our end to the work that our critical care ICU physicians did.
Congratulations, Dr. Apostolos Tassiopoulos.
I'd like to thank CEO Dr. Jeffrey Vasurka.
All my colleagues at Stony Brook.
To my coworkers, especially my night shift girls.
I really want to thank my partners and staff.
My principal, Judy Anderson.
Thank you to that non-clinical staff.
My staff that was here during the height of the pandemic.
All the disciplines, starting from the transporters to housekeeping.
Thank you to the community for stepping up and supporting. You have no idea the difference that made to help us get through this time.
Next, we recognize our honoree in the category of senior care, recognizing a facility caring for the aging population for excellence in care and service.
Founded in 1988 by 5 women, the Long Island Alzheimer's and Dementia Center aims to improve the quality of life for those living with Alzheimer's disease and related forms of dementia. When forced to close their Westbury Center for in-person programming due to the pandemic, their staff of social workers and program assistants stepped up. They developed robust online engagement programs, including virtual yoga, kickboxing, interactive craft projects, brain fitness, support groups, and self-care programming. Through their online programming, they were able to make a positive difference in their existing clientele, as well as expand their reach.
When our doors closed in March of 2020, my staff pivoted very quickly to virtual programs. Most of our services and programs were in person, so this was quite the change. We have enough to deal with when they're dealing with memory impaired, and then to add computers to the mix makes it very hard for them to communicate. So this has been a very, very trying time, and my staff has remained very dedicated to the mission.
Congratulations, Long Island Alzheimer's and Dementia Center.
Congratulations to the Long Island Alzheimer's and Dementia Center. We continue with our Special Needs Advocates of the Year, which highlights 2 individuals for a profound impact on their support of the special needs community.
Long Island native Dr. James Powell is the Chief Executive Officer for Long Island Select Healthcare. He successfully leveraged prior experience in telehealth programs in 2020 and provided free tablets and internet access to numerous patients, group homes, and support agencies in the community. Through this effort, Long Island Select Healthcare has been able to deploy hundreds of tablets to those in need. In addition to this work, Dr. Powell writes a monthly article called Stories from the Stethoscope that shares the lessons he has learned from his patients during his clinical career.
I find my patients allow me to be vulnerable, allow me to ask questions, and it's made me a lifelong learner, and I'm so thankful for that. I think our whole expanded home care program during the pandemic was a big win for us. We won telemedicine dollars so we could deploy tablets with free Wi-Fi to patients, so regardless of their ability to pay, we're able to give them technology. That rolled into home blood testing, flu shots, COVID swabs for those who needed it. So we're able to give care to those at the house without having them have to leave the house. So it created a safe environment, created an opportunity for us to reach our patients. So for us, it was a huge, huge win during this pandemic.
Congratulations to Dr. James Powell.
As the school nurse for ACDS, an agency for families and children with Down syndrome and other developmental disabilities, Debbie Vaccaro has been crucial in ensuring the health and safety of staff and students. Debbie consistently educated the ACDS team and provided support on the evolving protocols regarding the coronavirus. She authored the organization's reopening plan, developed safe programs, and acted as a salve for concerned parents and staff. In addition to her work with ACDS, Debbie also works with terminally ill patients in her capacity as a registered nurse for Northwell Hospice Care Network.
We actually remained closed for 5 months. During that time, I researched, studied, and attended as many COVID-19 conferences as I could, so I would be prepared when ACDS finally reopened. I actually also became a contact tracer. When the school reopened and we had our first positive case in November, I felt I was able to stop the spread of COVID-19 immediately because I knew what to do. We stayed open because we serve children with special needs. They need to be in school. They need their services. Because I understood the recommendations of the Department of Health and CDC, I feel it's put me in a better position to keep the children and staff safe and keep COVID out of ACDS.
Congratulations, Deborah Vaccaro.
Congratulations to our Special Needs Advocates of the Year. Next is our honorees in the category of Spirit of Advocacy, honoring individuals and organizations that have focused attention on a healthcare issue or help solve a community problem.
Board-certified dermatologist Dr. Stacy Brisman identified a major problem with dermatological care: the length of time it takes to get an appointment. To help solve this issue, Dr. Brisman founded Walk-In Dermatology, a practice that uses same-day scheduling and top-of-the-line technology to eliminate lengthy wait times. This transformative, convenient care approach to dermatology has significantly improved patient outcomes, thereby relieving unnecessary burden on the healthcare system as a whole.
After spending almost a decade in private practice as a dermatologist on Long Island, it became very clear that we were not addressing the full needs of our patients, mainly in the fact that we were not accessible for them and when they had acute needs that came up. So I had a vision to be able to make dermatologic care more accessible and more convenient for our patients. It's been a great experience, both the patients who are extremely appreciative for the care that they're given, and for the dermatologists to know that we're taking care of skincare needs immediately and when they first arrive.
Congratulations, Dr. Stacy Brisman.
As the CEO and founder of Care Answered, a healthcare coordination and patient advocacy organization, Nicole Christensen's vision is for patients and caregivers to easily access vital services. During the COVID-19 pandemic, Nicole developed free webinars sharing vital information and resources for those in need, while also providing free consultations and advocacy support. As the pandemic shined a light on healthcare disparities for minority populations, she also developed health disparity webinars to foster conversation, education, understanding, and action to help bridge the gap.
We're always learning in the world of healthcare and advocacy, but we really took the opportunity to try to delve down deep into the situations that were happening and how it was affecting so many people. So we did webinars on isolation and loneliness, partnering with healthcare professionals and mental health professionals and drama therapists to get that information out there. What can we provide them so that that isolation won't lead to loneliness and then potentially mental illness and physical illness?
Congratulations, Nicole Christensen.
When tasked with implementing saliva testing for all on-campus students, faculty, and administrators, Suffolk County Community College's School of Nursing was able to develop and deliver an innovative solution that resulted in the successful testing of more than 5,500 college students and staff between October and December 2020. Despite the COVID-related cancellation of student clinical experiences needed by nursing students for timely degree completion, the school found a resolution that provided students with required practical healthcare experience, in addition to a unique opportunity to learn about infection control. The School of Nursing's efforts have been celebrated for creating a unique solution while sufficiently preparing the next generation of Long Island healthcare heroes.
We have an amazing staff of faculty and students in the School of Nursing. They have, in addition to the COVID testing, of volunteering their time into mobilizing the college into a testing clinic. So within 3 hours, I was able to get 65 students who volunteered and have went through the training.
Many of our students have been out in the workforce. Many of them are married. Some take care of loved ones. So volunteering their time is not something that they're really doing in their spare time. They're taking time away from their studies, time away from their families and their loved ones to help fight this pandemic. And this is a real sacrifice on their part, and it's why we're so very proud of them for doing so.
Congratulations, Suffolk County Community College's School of Nursing.
Dr. Santhosh Paulus not only serves as Northwell Health's Senior Program Director for the Human Trafficking Heart Program, but also founded the Cycling for Change organization to raise funds and awareness to fight human trafficking. Amid the pandemic, Dr. Paulus needed to spend more time in the hospital helping COVID-19 patients, while also addressing the needs of those whose vulnerabilities were exacerbated by the financial effects of the pandemic. To do this, he and his colleagues worked tirelessly to offer care, comfort, and hope to those in need. And that has made all the difference.
I think what makes me really hopeful for the future is just how much people have come together, even during these times. In healthcare, regardless of how busy we've been able to actually expand our work, and that's because of having a strong team. And I'm hopeful that we can continue to make progress and continue to do the work that we're doing because of the team that we have and because of the way that we're able to work together.
Congratulations, Dr. Paulus.
Open for nearly a single year, Phillips Family Cancer Center, a part of Stony Brook Medicine, was challenged with this worldwide pandemic. During the height of the virus's spread, the center opened its doors to all of the Stony Brook University Hospital Cancer Center patients, as that building had been converted into a COVID cohort area. The Phillips Family Cancer Center increased hours and days to accommodate the influx of patients, which more than doubled the normal patient flow and increased treatments to 600. The center staff was fully committed to providing thoughtful, compassionate care to high-risk individuals in need of vital treatment.
As a cancer specialist, I'm an advocate of our patients, and I believe that regionalizing the cancer center from the main hospital or main hub to where you're living is very important. And even though some type of cancer care can be done as a one-time, but subsequent follow-up care is also very important. Far majority of the cancer cares can be done at the area where you're living. Phillips Family Cancer Center in Southampton tried to achieve that goal.
Congratulations, Phillips Family Cancer Center.
Dana Arnone, registered nurse and owner of Reliance Home Senior Services, was driven to found a nonprofit organization that could address the growing issue of transportation access for caregivers. Through the organization, All Things Home Care, Dana works tirelessly to obtain vital funding to pay for transportation services in order to get professional caregivers to and from their patients' homes safely and reliably. Her passion to provide seniors with this essential service and caregivers with reliable transportation has already made waves in the caregiving community on Long Island and beyond.
As owner of a home care agency located in Nassau County, during COVID, it was unbelievably horrific what we were going through. A lot of businesses suffered, a lot of businesses went through, some trying times, but we were getting the same calls from the families and the same concerns from the workers about transportation. How are they going to get there? Are they going to be exposed? Multiple buses being taken to get to one patient's house. And the fear of COVID and the exposure to COVID over and over again was just something that we had to resolve.
Congratulations, Dana.
I want to truly thank my unsung hero during COVID, and that was my husband.
My wife and my newborn.
My husband and my kids. My son for inspiring me to wake up every morning and help people. My fiance, Joseph Rossi.
My family
for doing multiple Zooms and FaceTimes so I could see my children and grandchildren.
All of the healthcare providers who have been there hands-on from day one.
From the bottom of my heart.
Keep up the good work. All of our more than 1,000 staff.
To all the healthcare workers out there, thank you so much.
We really, really appreciate it.
Everyone who has dedicated themselves, their lives.
Thank you for everything.
Congratulations to all our Spirit of Advocacy honorees. Now we honor our Volunteer of the Year, who this year represents a healthcare worker who has managed to donate much of their spare time to helping additional healthcare related efforts.
Since 1992, Dr. Kevin Glassman has reached outside his regular practice to participate in regional efforts that help others. Most recently, he has volunteered as a COVID-19 first responder and is behind the vital efforts to administer vaccinations. In addition to donating his time with the Nassau County Medical Research Corporation, Dr. Glassman sits on the board of directors for the ALS Association Greater New York Chapter, is the president of the Carlos Otis Urgent Care Center, and volunteers his time to the National Ski Patrol and the NYS Fraternal Order of Police. Dr. Glassman also established the Kevin and Teresa Glassman Foundation to further his philanthropic endeavors.
My wife really started me on a path for volunteering. She's an extraordinary example for me of what it takes to give of your time to others. I wanted to devote a portion of my life as I got a bit further into my career to others and to give back. The more I do, really the better I feel about my life and the example I hopefully set for others. If somebody were looking to volunteer and do work on their free time, you have to really ask that hard question, which is, can I make the time to be able to volunteer? And sometimes volunteering, you have to start somewhere. As you begin to volunteer, you begin to understand other people's needs and other people's desires and how you might be able to facilitate that.
Congratulations, Dr. Kevin Glassman.
Congratulations, Dr. Kevin Glassman. And finally, we debut this year's Workplace Wellness Award, recognizing the head of a healthcare division that is committed to integrating wellness programs that benefit staff's mental and physical health.
As Vice President of Workforce Safety for the largest healthcare network in the state of New York, Joseph Malloy revolutionized Northwell Health's approach to workers' compensation. He created the Workforce Safety Department in 2014 to foster a culture of safety and advocacy for employees, patients, and their families. It has received prestigious award recognitions, and Joseph has driven an operational savings of more than $20 million, while decreasing long-term liabilities by over $10 million since the program's inception. He also designed, developed, and deployed Workforce Safety's Safe Patient Handling Mobile Training Unit, the only one of its kind in the U.S.
We have something called Team Lavender for situations where frontline people are dealing with patients passing away, which we made sure that we connected our EAP services to our behavioral health service line, and also professionals who were willing to work with the team members who are under those stresses. We take safety of our employees very seriously. One issue that we wanted to make sure of was that the PPE that we did have properly fitted to each of the team members to make sure that it was most effective as it was designed to be. We have to be able to take care of these patients, and if we can't take care of our own team members, how can we functionally take care of all of these patients? So it was tied together, patient experience and employee engagement, wanting to have employees focus on, you need to take care of self.
I just wanted to take a minute today to congratulate Joe Malloy, our Vice President of Workforce Safety, on this extremely well-deserved award from the Long Island Business News. Joe, you know myself as an occupational environmental medicine physician. I've dedicated my entire professional career to the safety of employees at work. And I just want to say it's such an honor and privilege to partner with you every single day in your role as the Vice President of Workforce Safety. I always look to you for leadership and guidance, and I want to thank you for your dedication to keeping all the team members here at Northwell safe.
Congratulations, Joseph Malloy.
Congratulations, Joseph Malloy and the team at the Workforce Safety Department at Northwell Health. And help me congratulate all of today's incredible honorees. It has truly been an honor to highlight these healthcare community members. And from all of us at LIBN and Long Island at large, we thank you for your dedication. Thank you as well to today's event sponsors. Our major sponsor, Mazars. Our award sponsor, National EAP. Our contributing sponsors, Stony Brook Medicine, Ideal Health, Damianos Realty Group, and Long Island Community Hospital. Our virtual celebration sponsor, Northwell Health. And our nonprofit sponsors, All Things Home Care, Mount Sinai South Nassau, Family Service League, CN Guidance and Counseling Services, and Gerwin Jewish Nursing and Rehabilitation Center. Don't forget to tune in for LIBN's next web-based program, the Executive Circle Awards, airing May 6th at 4 p.m. Go to libn.com/executive circle for more information. And on behalf of all of us at Long Island Business News, thank you for joining us for this very special program. Stay safe, and we'll see you soon.